Cardiac murmur, who am I? Part 5. Can you guess what is this? My patient has completely normal pulse, no change. Regular rhythm, good volume, not slow rising, not collapsing. Pulse is completely normal. Jugular venous pressure, no change in the height, no change in the waveform pattern. It is completely normal. Careful inspection of the precordium. Again, no significant change. Up to now, nothing. Palpation of the precordium. Palpation. Apex, fifth intercostal space, mid-clavicular line. Normal nature. Not tapping, not thrusting, not heaving. It is in normal nature. In usual position. That means apex completely normal. But there is a parasternal heave. There is a parasternal heave. When I palpate for parasternal heave, hand go out and go in, go out and go in with each beat of heart. That means there is some degree of right ventricular hypertrophy. Right ventricular hypertrophy. Careful auscultation. What I can hear is ejection systolic murmur. Best heard in the pulmonary area. Pulmonary area means left parasternal edge, second intercostal space. That is the best heard area. Not only that, wide fixed splitting S2. What does that mean? Your first heart sound is called S1. Second heart sound is called S2. S1 is due to what? Closure of tricuspid valve and mitral valve. S1 is due to closure of tricuspid valve and mitral valve. S2 or second heart sound is due to closure of aortic valve and pulmonary valve. When I expand this first heart sound, what I can see is closure of tricuspid and mitral valve both happen same time. Both happen same time. When I expand this one, what I can see is aortic valve closure occur some degree earlier than pulmonary valve closure. This is aortic valve. This is pulmonary valve. Why it is due to? Your right side of the heart, right ventricle, here the maximum pressure is 25 mm mercury. Here maximum pressure, left ventricle maximum pressure is 120 mm mercury. If you are a normal person. So this ventricle has to pump with high pressure. They can empty earlier than aortic valve closed. This right ventricle have low pressure. So they have to eject for a long time in order to eject the blood which contained in the right ventricle. So closure of pulmonary valve little bit delayed. This is called splitting of second heart sound. Let's see what happened during the inspiration. Inspiration, what happened? Lot of blood come into the right ventricle, right atrium followed by right ventricle. So it will take further time to empty your right ventricle and closure of pulmonary valve. So it further delayed during the inspiration. During the inspiration, splitting become more pronounced. You can clearly hear splitting of second heart sound during the inspiration. What happened here? Wide fixed splitting is 2. That splitting change during the inspiration and expiration not happen here. It is fixed. Either inspiration or either expiration, this splitting is fixed. Duration of splitting is fixed. Not only that, wide. Previously splitting is this much. Now splitting is this much wide, but it not change with inspiration or expiration. This is the clinical picture your patient has. Parasternal heave, ejection systolic murmur, best heard in the pulmonary area with wide fixed splitting S2. Now you know the diagnosis. 1, 2, 3, 4, 5. Diagnosis is atrial septal defect. Atrial septal defect here. there is a connection between the two atria. We'll see what happened. How they develop parasternal here. Usually your left atrium has little bit higher pressure than right atrium. Because of that, blood start to come from here to here. Then what happened? Right atrium become volume overload. Right atrium become volume overload. Then subsequently right ventricle also become volume overload. With that, what happened? Right ventricle gradually become enlarged and hypertrophy. So right ventricular hypertrophy is there. Your patient develop parasternal here. Number one. Then ejection systolic murmur. During the contraction of the atria, what happened? Blood come from here to here. This turbulent flow produce sound during ejection. That is why they develop ejection systolic murmur. Best heard in the pulmonary area. Your left atrium somewhere here, right atrium somewhere here, blood come from here to here. Best heard must be at pulmonary area then. Next one, how they develop fixed splitting of S2. Fixed splitting of S2. Two atria now compensate from here to here. If this one has less amount of blood, what happened? Blood come from here to here. Then splitting become more wide. During expiration, your right atrium have lesser amount of blood. Why? During expiration, thoracic cavity pressure little bit less negative. Because of that, blood reluctant to come into the right atrium. So right atrium volume less, left atrium volume high. What happened during expiration? Blood from left atrium to right atrium come from here to here. Splitting now what happened? Splitting again now wide. So wide splitting is there and it is fixed as well because time to time it change. That is all regarding the atrial septal defect. Thank you very much.